Hi, welcome. Being a middle-aged woman comes with wisdom, newfound freedoms, the ability to appreciate the little things, and grandkids. But it also comes with menopause and perimenopause, those rocky years leading up to the end of your monthly cycles. This transitional period is fraught with uncomfortable and sometimes concerning symptoms. In this video, I'm going to focus specifically on digestive changes because they can be intense, and I speak from experience when I say they can really affect quality of living. Both perimenopause and menopause can affect the GI tract from one end to the other, but there are 4 common changes that I want to focus on today. So let's start at the stomach and work our way down. The first complaint is nausea, and this is one that tortures me almost daily. It is so incredibly hard to function every day when you constantly feel as if you're going to throw up. Not a pleasant experience at all. I am sure all of you ladies that suffer with constant nausea know how debilitating it can actually be. Drops in estrogen, which are commonplace during perimenopause and more so in menopause, cause heightened cortisol and adrenaline, which puts the body into fight or flight mode. When this happens, digestion, unfortunately, is one of the first non-essential processes to be shut down in preparation for action. This slower digestion can cause nausea. This sensation of feeling sick to your stomach can come in waves, or it can be constant. If you're one of the lucky ones, your nausea's coming in waves, although if those waves occur in the morning, it can lead many women to believe that it's morning sickness and that they may be pregnant. I happen to be one of the not so lucky ladies that has almost constant nausea, and I'm always looking for possible solutions to help me get through the day. There are anti-nausea medications over the counter that may be helpful to some, although they didn't do much for me personally. Avoidance of certain foods such as coffee, chocolate, fried or fatty foods, soda, and foods that I'm allergic or intolerant to has proven most effective for me and may be helpful for some of you as well. Eating smaller meals, chewing slowly, and sipping herbal teas may help alleviate some nausea as well. Another common problem in midlife is indigestion, which is also caused by the effects of increased cortisol on the digestive system, as well as low estrogen's effect on stomach acid. It causes queasiness, discomfort, pain, burning, a feeling of fullness, bloating, and belching, and can also affect quality of living. One of the go-to treatments for many doctors is PPIs, which reduce stomach acid, and while they can be effective, it's very important to be aware that taking these medications long-term can interfere with nutrients such as calcium, magnesium, and vitamin B12, which are vital to women in menopause and perimenopause. Deficiencies can result in osteoporosis, palpitations, anxiety, muscle aches, joint pain, and improper nerve function. So please have your vitamin and mineral levels monitored by a doctor if you're taking these types of medications for an extended period of time. More natural approaches to alleviating indigestion are to 1, have a look at your diet and try eliminating trigger foods such as coffee, chocolate, onions, citrus, tomato, and peppermint. 2, eat small meals and chew slowly. 3, do not ever go to bed right after eating. 4, never lie down after eating. And 5, try not to exercise on a full stomach. Further down the digestive tract, bloating can be a real issue when hormones shift. And although it doesn't sound like a very serious problem, it can be downright painful. Bloating can be so significant during perimenopause and menopause that it can become very difficult to breathe and can cause significant abdominal pain. Bloating can be caused by water retention or excess gas. Low estrogen causes less bile, which means that fats are not digested as efficiently as they should be. It also causes slower digestion, both of which cause a buildup of excess gas and cause the body to bloat. High estrogen, on the other hand, can cause the body to retain water, which can also cause bloating. To minimize bloating, try changing your diet to avoid gassy foods such as high-fat foods, certain veggies such as broccoli, beans, and dairy. You can also try exercising because working up a sweat not only helps with water retention, but moving food through the body as well. Lowering your salt is also a good idea because high sodium can also cause the body to retain water. Probiotics can also promote digestive health by introducing good bacteria into the gut. Many women find them very useful, while others find them triggering. Probiotics make me ill personally, so I try to get mine through food. But test them out and see if they might be helpful for you. As I mentioned with indigestion, eating smaller meals is a very good idea because it makes digestion much easier. Staying hydrated is also very important. I realize that excess water can cause bloating, but drinking ample water every day is not the excess water that leads to bloating, and it is vital for moving nutrients throughout the body and keeping things moving smoothly. If bloating remains excessive despite all of these natural solutions, it may be worth talking to your doctor to see if medication may be needed. The next common complaint in perimenopause and menopause is irritable bowels. This can manifest as diarrhea or constipation, and many women switch between the two from week to week. Unfortunately, shifting hormones can be the cause. The muscles in the gut have estrogen receptors, so a drop in estrogen can reduce muscle tone, slow transit time, and trigger diarrhea or constipation. Hormones also play a role in inflammation, which can make matters much worse. You can try and ease bowel disruption by keeping a clean diet and avoiding triggering foods such as alcohol, spicy foods, coffee, and carbonated beverages. Also aim to get enough sleep. Lack of sleep can affect the immune system and increase the likelihood of flare-ups. Exercise will help improve your sleep and motility, and as an added bonus, will help you control your weight. And don't forget to stay hydrated. Hydration is vital for proper bowel function. It will keep things moving smoothly. Digestive problems can really mess with our quality of living and make daily functioning a real challenge. Staying in tune with your body and doing what you can to stay happy and healthy is really important in middle age. We can all make it through perimenopause and into menopause. It may take a bit of work, but I feel confident that we can all cross over into postmenopause feeling healthy and strong. I hope you enjoyed the video. If you would like to see more content like this, subscribe and click the bell. I make videos on all things midlife. Go out and live your best midlives, everyone, and I will see you in the next video. Bye for now.